Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Yes,
therapist.
it's on. And together we are the most famous physical therapists on the internet.
In our opinion, of course,
Right,
Bob.
right. Today we're going to talk about Dupuytren's Contracture. D-U-P-U-Y-T-R-E-N-S. Dupuytren's Contracture. Who's it named after, Brad?
Baron Guillaume Dupuytren in 1831, he was a surgeon.
Right. And so it's been around a long time. Some notable people that have had it. You said Ronald Reagan and Margaret Thatcher.
Right.
So, and Bob Schrupp, and I'm going to show you it in just a minute so you can see the an up close and personal view of Dupuytren.
Right.
So, generally it starts off as a little nodule or lump on your hand, and you know, some people are concerned about it. I was concerned when it started, and I actually started 25 years ago. I remember the time because I was working with this doctor, and that was 25 years ago. And he looked at me and he goes, "Oh, it's nothing to worry about." And he told me what it was, but the problem is it just gets worse and worse. It's a nodule, then it becomes kind of a cord, and it starts to affect generally these two fingers, the ring finger and the little finger, and it starts to tighten up those cords to the point where it starts pulling the finger down. And now I'm going to reveal it, Brad.
Yeah.
So
Yeah,
I'll bring it up to the camera so you can see. There it is. Now in my case, it really only affected the ring finger,
Put it at an angle like...
Oh, like this? So you can see it that way.
Yeah, that finger doesn't, I can't straighten.
Yeah, I can't go up. Now my little finger does. That goes all the way up. It's not affected. It's just the ring finger. I can't wear a ring on it, by the way, which is my wedding ring finger. But other interesting things where it really hasn't affected me that badly. I have trouble playing basketball because I can't grab the ball with that hand. I have trouble putting a glove on to some extent. I can't wash my hair with this hand. I just do it with one hand. I can't wash my face with one hand. Really tough for people who play like the piano or I think like a flute or some other instrument. In those cases, they probably really are going to need to have something done. What's interesting about this, Brad, is, and we're having this discussion, my wife and children did not know I had this for 20 years. And the only reason they knew it after the 20 years is I told them. And I don't know that you knew either.
I'm not sure. I don't remember, but I noticed it in the videos. So I don't know if any of our subscribers or viewers have noticed it. What's wrong with that finger?
Make a comment below, but it's also called Viking or Celtic hand. What's interesting is it often happens in people with Northern European descent, which I am German, very often male, and it is inherited. So, okay, let's talk about treatment approaches, Brad. And as a good teacher, we'll flip up here. Okay, here they are, really 4 treatment approaches. Number 1 is surgery. The thing with surgery, it is invasive, it can be painful. 2 to 3 months of rehab after surgery, which is a long time, and you know what? It can come back. This thing, there's no cure for it. This is basically a disease, but surgery offers the longest relief of these 4 options. The second approach is called needle aponeurotomy. And basically in that case, all they're doing, Brad, is taking a needle and going along. It's done in the surgical office, in the surgeon's office, and they're just breaking up that cord. They just kind of work along. The surgery, and I watched that. There's a big cut that they make. It's a big scar. And this one, they're just going a needle, they're breaking up the cords. It's a short rehab. But the one surgeon I watched in the Mayo Clinic, he said, they don't have studies on it, but based upon his experience, about 20 to 30%, or 25 to 30% reoccur within about 2 years. So it's not as bad, but generally it does come back. The third one now, and I just saw an ad for this in the paper, Brad, a big full-page ad, collagenase injections. And the chemical I saw is Xiaflex, and this chemical dissolves the cord. Injects in there. I think it's a one office visit. You still have reoccurrence, but the biggest negative about that is it's very expensive. I don't know what each treatment costs or what one procedure costs, but they said a vial costs $3,000. So
don't drop that one.
Yeah, don't drop that vial. Yeah. And the fourth approach is the one I've been doing, Brad, is observation. In most cases, this Dupuytren's contracture does not hurt. I saw a few cases where people had itching or they had some burning pain.
Sure.
I've never had any pain. I can still golf. That's the most important thing. If I couldn't golf, I would have went in and had that procedure done right away. But I got good grip.
Yeah.
I mean, so.
Like I said, it might be better for grip.
Yeah, it might even be better. I'm already in the gripping position. So that's kind of where I'm at. The other thing is, you know, I'm probably not going to do anything about it unless it starts to go to the point where, you know, Brad, if you look at it now, if it starts getting down like this, to the point where I can't even, they said it becomes, you can't even clean in there.
Right,
and
sure.
Fungus grows.
Yeah, that would be fun, Brian.
Yeah, that would be fun, wouldn't it?
Your wife will like that.
Yeah. Then in that case, maybe I'll have something done. But
now, with yours, how long did it take before it contracted to the point it is now?
I would say probably a good 20 years.
It just slowly...
Yeah, it just slowly goes. I used to try to stretch it, but they said nothing really stops it. Sometimes you can do a cortisone shot and it'll slow it down.
Yeah.
You know, it just slows the process down. But it's been kind of stuck at this level for quite a while, so I'm hoping it doesn't get any worse.
And it's not painful, does it?
No, it's not painful. Okay. In the whole scheme of things you can get in life, I think this is a minor one.
Right.
So I'm not going to worry about it.
Sure.
So,
all right.
And I could be a Packer fan. So that would really be a bad thing.
Bring it on, guy. Bring it in.
All right, if you want to subscribe, we'd like you to please join our cult.
You bet.
You just go and push the button below, or is it above? I don't know where it is. But we provide videos on how to stay healthy and fit well into your 80s and 90s. 40 and above is generally our audience, isn't it, Brad?
Yeah, 40 and above. And once again, if you want to feel strong like a bull, like me,
yeah,
these videos are going to help you with that.
There's a lot of bull going on. All right, thanks.